KREM 2 Morning News starts now.
It's so very contagious that in a public setting, a susceptible person can get measles if they're not vaccinated.
Spokane's first confirmed measles case in more than 2 decades, with the patient going to work and visiting a few other spots while likely contagious, one of them a gym, and we're checking in there this morning as well. We're at 5:30, 45 degrees. Thank you for joining us today. I'm Sten Wallstrom.
Hi everyone, I'm Laura Papetti.
And I'm Jen York.
As we continue to follow this developing local case this morning, we're live at another location that a measles patient visited during the time that he was potentially contagious. And this does include the North Park Racquet and Athletic Club. That's on North Division, and that is where we find Francis Wang this morning. Good morning.
Good morning, Laura. Well, the patient spent about 5 hours here at the North Park Racquet Club on Monday. Now, there's no longer a risk at any of these businesses, so as you can see, the gym here is open as usual. Now, the patient arrived just after 1 o'clock last Monday, stayed here until 6 p.m. KREM 2 News spoke with an epidemiologist from the Spokane Regional Health District to see what will be done today to follow up on this patient's current health and the risk of a bigger outbreak in the area.
So we're working with the clinic and the hospital to verify the immune status of those healthcare workers who served the case. And then the hospital and clinics are taking on notifying the persons who were in those areas when the case was there.
Measles are hard to control because infectious particles can linger in the air. If a person was in the room for an hour, the infectious particles could be around for 2 hours when the person leaves. She says it's also very contagious in a public setting, so it is possible to get if you're not vaccinated. That's why the facility would have to notify not only everyone who was here at the same time as the infected person, but also the people who were there 2 hours after as well. Now, the epidemiologist has spoken to the infected patient. She says he's still sick and staying at home, but says he's no longer contagious at this time. Now, since the news just broke last night about the measles case, I'm here at the gym to see if anyone is still coming. As you can see, there's about a dozen cars or so here, regular amount of people at the gym this early in the morning. Reporting live from the North Park Racquet Club, I'm Francis Wang, KREM 2 News.
We mentioned some parents opted to skip or delay vaccinations recently. Infectious disease experts insist much of the anxiety about vaccines is based on myth or misinformation,
including that vaccines cause autism, a case where the medical community says no, pointing to at least 14 scientific studies have failed to find a link between autism and vaccines. The myth was fueled by a small, flawed study in 1988, which was later retracted. 4 years later, the author of that study was found guilty of serious misconduct related to the study. Another myth that vaccines contain toxic chemicals like mercury. Doctors say vaccines have never contained mercury and only contain trace amounts of aluminum and formaldehyde. For the full list of facts versus myths, head to our website, krem.com.
Today, we do want to invite you to join in on this conversation. We will have Dr. Joel McCullough from the Spokane Regional Health District here in our studio coming up during our 6 o'clock hour. And Stem will be interviewing him with a list of questions. And we also want to hear from you at home. Send us your questions, your concerns. You can post them on our Facebook page or use Twitter. And we're using the hashtag KREMmeasles. Again, it's a great way for us to go ahead and ask those questions, get some answers as we look at fact and not fiction.